My name is Laurie Meythaler-Mullins, and I'm going to talk about the Hub Outpost Project. This is a project, a joint effort through Colorado State University and the University of Alaska at Fairbanks. And we provide veterinary care to a region in Southwest Alaska that has previously lacked access to veterinary care. This region is the YukonKosokum Delta in the southwestern corner of the state. And this region is completely off the road system, and it's comprised of 58 federally recognized tribes spread among 48 villages in an area about the size of Louisiana. And these communities have historically lived very closely with dogs, using them for transportation up until 1950. And now they are still used for the sport of dog mushing, companionship, hunting. Dogs still serve very important roles in these communities. Our project was contacted by Night Mute just a couple weeks ago in March. This is March 2021, when a fox entered the community and attacked an unvaccinated dog. In this community of 280 people, approximately, I would say most of the dogs are unvaccinated. So there was concern because foxes in this region have rabies. So we were able to get the fox sent in to where I live in Bethel and then sent on to Fairbanks, the state virology lab, confirmed that this fox did indeed have rabies. And unfortunately, the dog that it attacked was shot. But concerns with other dogs in the community who were unvaccinated. And this is Albert Olesk. Albert is a tribal police officer who helped our project when we visited the community of Night Mute. And Albert helped us go door to door to provide rabies vaccinations to all of the households in Night Mute. So we traveled door to door to rabies vaccinate. We also provided distemper parvovirus vaccinations and antibiotic treatments, as some of the parasites in this region here that dogs carry that can be transmitted to humans also include echinococcus, which causes some pretty serious disease. In this picture here, you'll see there's quite a few children watching the rabies vaccinations. Part of our project too, we always visit schools and talk about dog care, veterinary medicine, and One Health issues. It's not unusual since these communities have never had access to veterinary care. I often find in the schools, children aren't even certain, what a veterinarian is, much less what they do. While in communities, we also provide spayneuter sterilization surgeries to help reduce unwanted dog populations. So it's a combined One Health effort, because we believe that improving the health of dogs